Hi everyone, I'm Carlton D'Souza and this is Million Opinions. In today's episode, we have Dr. Arif Khan, who is a pediatric neurologist, a child brain expert, and an associate professor. He is also the founder and CEO at Neuropedia Dubai, MD of Kids Neuro Clinic, and founder at Extremity Prosthetics. Dr. Arif Khan, welcome to Million Opinions. Dr. Arif Khan, you have many companies in the UAE, and you've been here. You've been brought up here.
Yes, I mean that was decades ago. I mean 70s and 80s when I grew up here. Obviously, I didn't have anything to do with that decision. It was my parents. So my father used to work here from 70s and throughout. He just retired about 8 years ago. So for him, it's not the second, obviously first home almost. But he migrated from India over here, and he worked for one company for 43 years.
Wow.
And that doesn't happen anymore.
No, not anymore, no. So you have companies here. There is Neuropedia Dubai, Kids Neuro Clinic, and Extremity.
That's correct. 3 of them. Yeah.
And you are a child brain expert.
Yes, by profession, I'm a consultant pediatric neurologist, which is a children's brain doctor.
So can you tell me more about these companies, doctor, and what is it that you do?
So Neuropedia Children's Neuroscience Center started in 2017. That's when we laid the foundation, and it was operational by the end of 2017. So it's been nearly 7 years now that we've been in operations in Dubai. Then about 2.5 years later, we opened a branch in Sharjah, which is in Sahara Healthcare City. There is a tall building on the 7th floor. And following that, we started Extremity, which is a orthotics and prosthetic center, which kind of helps or feeds into the other clinics. We help children with cerebral palsy, children with limb deficits, creating prosthetics for them and so forth. And that's the only one which is in the country, which is oriented for children itself. And then Kids Neuro Clinic opened last year, which is similar to Neuropedia, but a different brand, but in Healthcare City, which is a free zone area, as you know. What we do in Neuropedia Children's Neuroscience Center, we are a bunch of people. We started off with a number of staff being 13 in 2017, and now we have total of 77 staff between Dubai and Sharjah. We have pediatric neurologist, child psychologist, child psychiatrist, behavioral therapist and behavioral consultants. We have genetic doctors with us. We have physiotherapist, occupational therapist, speech therapist, dietitians. So all the professionals required to provide a holistic and interdisciplinary care to a child with a neurological, neurobehavioral or rehabilitative problem is available at Neuropedia. So we do everything related to the brain except surgeries. Obviously, for that you need a hospital setup, and we are connected with a number of hospitals to help us with that. Similarly, Kids Neuro Clinic, it started on a smaller scale. It does pretty much the same thing, whereas Extremity is more of a service platform or an agency that individualizes equipment to the need of the child. We measure the child, and we customize a prosthetic like a spinal brace or a foot orthosis or a prosthetic limb for the child based on the child's requirement. Either it is modeled outside in Europe or States and then brought in here and adjusted here. So we have collaboration with a number of international companies that help us with that.
So, doctor, you do help out parents and children with ADHD,
Yes.
speech therapy,
Yeah.
and if you could simplify some of these terms, because I know that the terms are very medical. Yeah. But for the listeners to understand it in a more simpler way.
Sure. So I always start from the concept of brain and mind.
Please, yes.
These are two separate things. Brain is, if I take my brain out and keep it on this table, that's my brain. It's morphological, it's structural, I can see it, I can scan it, I can image it. Mind is not brain. Mind is how your brain perceives things around you and how it relates to things and environment around us. So it is not tangible, but we are our mind rather than our brain, I must say that. So there are neurologists who deal with the brain, basically. Any neurological conditions that you have, like epilepsy, or if you have a brain tumor, or someone has a seizure, or neurogenetic problem, or
neurogenetic problem, if you could simplify.
related to genes, basically. Or if a child has cerebral palsy, anything that is structural in the brain, or a stroke, for example, is managed by neurologist. Neurobehavioral issues such as ADHD, as you said, or autism, for example, depression, then anxiety, many other psychological and psychiatric conditions are mind-related. Now, there's a big overlap of who or which clinician manages these two. It's between the neurologist, psychiatrist, and psychologist with the allied professionals that I listed earlier. So this is our core structure of how we operate as such. Now, what are the common conditions we see? ADHD is very common. The general prevalence of autism of ADHD is about 6 to 7% in the general population. And what is it? It is attention deficit hyperactivity disorder. And sometimes you can call it ADD, or attention deficit disorder, when it's predominantly attention is an issue and not hyperactivity. So 7% is like 7 out of 100 kids could have ADHD. So in a classroom of, say, 30 kids or 25 kids, you're looking at least 2 or 3 who might have ADHD. They may have the diagnosis, they may not. But they will suffer unless you pick them up and help them. And ADHD is a condition that is diagnosed by a neurologist or a psychiatrist or a psychologist. Sometimes they get onto medications to help them, sometimes they don't. The second biggest cluster of diagnosis that we make is autism. Autism, as you know, is a neurobehavioral condition, which involves 3 main components. There is deficit in a child's social interaction. There's a deficit in child's communication, which could be verbal or non-verbal. And they have certain mannerisms or certain rigidity of thoughts that makes them different from others. So it is a neurobehavioral condition, which is defined with these 3 main areas of deficits. How common is it? This is the fascinating bit. Today, from a recent survey in US, it's 1 in 36.
Wow.
About 2 years ago, it was 1 in 44. About 20 years ago, when I started my pediatric neurology journey, early 2000s, it was 1 in 1,000 or 1 in 800. In 70s, it was 1 in 4,000. So you can imagine the exponential rise in this. And there are many reasons for it. We can probably discuss this as we go through your podcast. But autism is a big thing that we treat or we help children with. Epilepsy is a third big group of conditions that we manage. And everybody knows what epilepsy is or seizures are. Cerebral palsy is the 4th biggest group that we treat in neuropedia. Then we have kids with certain specific deficits like speech delay, or kids with hemiplegia or paraplegia, that is weakness of the legs, or kids who have genetic conditions, we discussed that earlier, or kids with Tourette's syndrome or tics as such, which is again very common. Kids with migraine and headaches is a very common scenario that we come across. So a wide variety of conditions, because everything starts from the brain, and that's what we do and deal with, brain management.
So doctor, you say that you help them adjust to the world. And can we speak on how the parents, how open are they coming and reaching out to you?
It's condition specific.
Okay.
Like, for example, a child who has epilepsy. Mm-hmm. So they see the child having a seizure, they panic. So they have to see a doctor. Mm-hmm. But parents who see their child kind of having a deficit, a social deficit, like a child not speaking, not turning to his or her name, not socializing, being in isolation, they would just wait. They will wait. They'll get opinions from their relatives, their friends who would say, okay, get this child into a nursery. My child was the same. Let's give him some time. And they delay the diagnosis. Sometimes I see children with autism who are not brought to a doctor's attention until they are 5, 6, 7 years of age. And that's when the crucial period where we can do something about it in terms of intervention is lost. Our brain absorbs the best when you're between 2 and 4 years of age. So the earlier you make the diagnosis, the better the effect of interventions would be in that child. So I always tell parents, you don't lose anything. Getting your child to your pediatrician or your neurologist is just one step. He might just say, look, your child is fine, take him home. But don't run away from the fact that you might get a diagnosis of autism, because if he has it, you should know it, because you need to start treatment early.
Inclusivity. How inclusive are we? We train the child to adjust and adapt to the ways of the world, but what does the world do?
Yeah. Inclusivity has a number of definitions. So for the sake of your audience, I think the easiest way to explain that is to include children who are neurodiverse into the society that we've made. And I must say that I'm very privileged to be in Dubai, which is probably one of the most inclusive cities in the world, because I've worked in a number of cities, including a number of cities in the UK, in India. And inclusion, nobody does inclusion like Dubai does. A number of schools here, a number of British or American, Australian, Indian schools have inclusion departments within their school. And they have a certain guidance from KHDA, which is the Knowledge and Human Development Authority, to have a certain proportion of their kids on the neurodiverse range and have a right support in place to help them. Some of the schools have their own professionals who provide those inclusion facilities like speech therapists, occupational therapists, psychologists. Some schools are contracted with rehabilitation centers and clinics like Neuropedia to provide those facilities to them. But I have to tell parents that inclusion doesn't mean just getting a child on board in a school of mainstream schoolgoers. Inclusion means creating awareness among the people or the community within that school that kids with neurodiversity are a part of their culture. And we should not look at them in a way that we are doing a favor for them or we are just letting them be in our society. It's that they are a part of a society and they should integrate into our society, contributing to the enhancement of what we do regularly. So there's a big difference between acceptance and awareness. Many people are aware of it and they say, oh, we do inclusion and we are aware of it, but not many accept it at times. And that's where the change should be. Accepting a child who's neurodivergent into your society. And to do that doesn't mean just bringing them in a classroom where other kids are. Bringing them in a classroom where other kids are and letting them grow and giving them the right resources to progress in a fashion that the other kids are doing. And that's what true acceptance and inclusion is.
And how can the other kids help as well?
Awareness. So kids are kids. So if they see a child who's slightly different from them, the first thing they do is start experimenting with that child. So they will form groups. Sometimes bullying comes in. Sometimes they don't accept it. They're fearful maybe of a child who has a neurodivergent behavior or who screams in a classroom. So I, as a doctor, I know why kids on the autistic spectrum have their behaviors done. So I know why they do it, and therefore I'm not fearful of what they're going to do next. But kids who don't do that, who don't know that, or parents or adults who don't know why a child's certain behavior comes to the fore, they won't know how to manage that child. You have kids who stim, children with autism who stim. They keep doing this, and that helps them control their emotions. So if I'm in this room and I'm fearful of darkness or black color, you won't know that I'm fearful of black color. I won't be able to tell you that. But you've got black curtains around, and this is kind of hitting me all the time. And my behavior changes now. I'm fearful, I'm scared, I'm started screaming. I'm just doing this to control my fear. And you would think, oh, we're in a room, quiet room. Why am I doing this? But I cannot tell you that because I don't have the ability to communicate to you and say, this is the reason why I'm fearful or I'm doing this behavior. But the moment you identify that and you take these black curtains and replace it with white curtains, I settle down. And this is just an example. And you can look at, we have 7 senses, not just 5, but 7 senses. And you can imagine the number of stimulation that child gets from those 7 senses, whether it is the smell, the noise, the vision in the classroom that he is. And that's the job of specialists, to identify which of those sensory inputs the child is struggling with, and therefore his behavior is being affected. And how do we change that? And sensory adjustment is one of those things. Other things like, I'm just fearful of being among other kids who are, so they expect me to look at the teacher when she's teaching, but I cannot look into her eyes because the moment I look at someone's eyes, I cannot think. Let me give you an example, Carlton. Now, you and me, we are looking at each other. And the moment I ask you a question, Carlton, by the way, 3 years ago on the 5th of May, remember you had this party and what were you doing then? So if you have to make your brain work, the first thing you do is take your gaze away from me, right? You do this and, oh, by the way, this is what I did. Why do you do that?
To focus?
Yes. So when you look away from someone's direct eye contact and look away, it makes your brain concentrate on that 3 years back period. So I can give you the right answer. So for children with autism, we expect them to keep looking at our eyes when we talk. They cannot focus. They cannot pay any attention to you. They work better when they're not looking at you directly. And they are kind of involved with this and looking at arbitrary objects around, but they may answer to your questions or they may interact with you. But you as a person who's receiving this vibe from them would not think this is appropriate. Because in your society, people look at your eyes when you speak. And that's the difference. Knowing how they operate is more important for us to accept them and include them. And the problem today is not many do that. No, and because of awareness, it is getting better. It's not the same as it was 10 years ago, but it's getting much better now. And if you go to a school, everybody knows what autism is. Everybody knows what we should do to include children with autism. But still, a lot of work has to be done to kind of make this more widespread in society. If you go to a shopping center in a supermarket, and if you have a child stimming, you will have 30 people just staring at their child, or the parents thinking, "Oh, why is this parent's not doing anything about this?" Or the child is a brat or a spoiled kid, because of lack of awareness. Whether it's going to be there in 20 years' time or 30 years' time, I don't know. But the work has already started. Yeah.
Your podcast does speak a lot about so many things, and I wanted you to simplify for all of us so that we understand and make it as aware as possible. The costs, doctor, for children who are neurodiverse.
I think we have to be more condition specific. So something like...
No, let me rephrase the question. So why I ask you about cost is sometimes parents are worried if we go and approach a doctor and my child gets labeled as a neurodiverse child, everything changes. You need to pay for the LSA, you need to pay for the occupational therapist, and does insurance support in this? It also depends on the socio-economical place of the parent or individual. So there's so many factors to it. How do we bridge that along with the awareness?
So let's just take an example of, say you've got a tumor or a mass in your hand, and you can see it. It's bulging, it's growing every day. You would not stop from going, nothing will stop you from going to a doctor and saying, "Look, this is a problem. Can you operate and take it out?" You wouldn't worry about the cost, would you? Because you're actually seeing it getting worse, or it's painful. You would do something to take it off early so that the outcome is better. But when it comes to neurobehavioral or social conditions like this, people feel that if I get a diagnosis, one, there will be cost, and two, it might label my child. But this is one message I want to give through your podcast. It's not about labeling a child, it's about enabling a child. You enable a child to achieve much higher potential if they don't receive therapies as compared to when they receive therapies. The cost for that family, if the child doesn't receive therapies in a timely manner, would be much higher in the future than what it is now. And the reason there is cost is because there's a lot of work involved from interventionists, therapists, and doctors to get that child in line with our societal norms, like improving their social skills, their language skills, their cognitive skills, and their IQ and social everything else. You need at least 4 or 5 different individuals working with your child. And that's why the cost is high. Your second question, do insurances cover it? Yes. In a place like Neuropedia or Kids Neuro Clinic, which are primarily based on that niche of helping children in the neuroscience area, insurances cover most of those consultations and therapies. Yes, when it comes to behavior therapies, what we call as ABA or providing certain behavioral interventions, insurances don't cover it. But I think things are changing. People are understanding, the insurance companies are understanding that that's the need of the hour. And from the US now, they have started accepting behavioral applications for insurance approvals, and that's coming to Dubai very soon, I think.
How does technology help or worsen the condition of neurodiverse children? And please, I know I'm using a very broad term. It's just because I'm ignorant. But tell us where it helps and where it doesn't. If you,
I think a big question that I get in my clinics is about screen time and screens. When we talk about technology, is what we consume most is a screen, isn't it? Yes. I mean, today, if you look at your iPhone and look at the amount of time you spend on the screen, having 8 to 9 hours a day is average, I think. Everybody looks at their phone for a number of reasons. And how we've been wired now is that if you don't look, you start panicking, you become anxious. I mean, do this experiment at home. Keep your phone next to you and ask someone else, or pay them maybe, to say every time you pick up the phone, just tick a box. And you would see that every 15 seconds to 30 seconds, you would pick your phone up, or maybe at least within a minute. If it rings, of course, a number of pings you get on your phone for different apps you can imagine. But even if you keep it on silent, there is an alarm clock in your head which says, okay, have I missed a message? Or even for entertainment, oh, is there a great news? Is there a good Instagram reel that has come up? And the moment you go onto Instagram, you keep scrolling. And this is the difference. Sorry, I'm digressing here.
No.
This is the difference between what we are doing now and what we were doing 20 years ago. So 20, 25 years ago, so we were sitting down having a cup of coffee in the morning. You have probably half an hour to spare. What would you do? You take a newspaper and start reading it to keep yourself busy and entertained. You might read a page, maybe you scan through a newspaper in 20 minutes and then keep the paper and move away because there is an end point to it. An Instagram feed or the reel doesn't have an end point. You just keep going and going, and even till your deathbed, you can continue doing that process without stopping. So there is no end to entertainment at this point of time, and that's what drives addiction in children
and adults.
Of course, and adults. But someone in our 50s, we are not saving anything anymore. We are saving the future generation from what screen is going to do to their eyes, their cognition, their intelligence, their attention, and so many other things. So coming back to your question about what screen is doing for children. So let's start with a simple thing like a cartoon or CBBS or anything like that. So what do you see on the screen? You see a number of colors and number of characters moving to and fro, and very quickly. And that's what keeps them engaged. It's colorful, it's moving all the time, and it's engaging. That's why kids want to look at it every day in the morning, and they get hooked onto it. At times, sitting there for hours looking at that. So imagine if you're doing this 3-4 hours a day to a 3-year-old or a 2.5-year-old. For them, the world has to move at that pace and in those colors. Imagine 3 hours every day. And as their brain is developing and absorbing all this, they believe that the world is going to be like this. Now, you go next day to a boring supermarket and ask them to stand in a queue. A queue which is boring, nothing to do. You just have to stand and wait for your turn. Why would they do it? Because for them, the world has to move. For them, everything is colorful. It has to move. And then that's when their behavior kicks in. They don't want to do that. They don't want to be static. They want every step to bring up a new picture for them. So they jump out, they scream, they try and grab something. They go and pick up something from the stack of shelves. And that's what they want their world to be then. Excessive screen time doesn't cause a condition. It doesn't cause autism or ADHD or epilepsy. No, it doesn't. And we know that for a fact. But excessive screen time does have an effect on your learning. It doesn't have an effect on your eventual brain perception of the society and how you socialize and how you interact with others, how you improve your communication skills. It does. It doesn't cause autism for sure. But kids who have already a diagnosis of autism, we tell them not to give them excessive screen time simply because we want them to socialize. We want them to be in the real world as such. Of course, we know the positives of screens, the amount of information there is, the amount of easy access to maps and information and data we get from screens.
Podcasts such as this.
I mean, today you can have 10 libraries, and I'm talking about national level libraries, in your pocket and walk around. Imagine 20 years ago, you had to go to a library, get a membership, pick up a book, take it home, read it, and then deliver it back. Today, it's at your hand. But human brain cannot absorb 10 libraries of information. Remember that. You need to choose what you're doing. And what we tend not to do is put that barrier around our kids' information. You are hit today with a lot of information as you grow older. Whether it is TV, mobile phones, parents screaming at you, an iPad lying down, school teaching something on a screen. There are so many pieces of information. So even simple things like putting parental control on a YouTube app. If you do a poll today in Dubai, how many parents actually put parental controls? I think it's going to be less than 10%. So now you have an open YouTube channel for a 3-year-old, 4-year-old, 5, maybe even a teenager. And they have access to everything there is on YouTube. It's really scary what they can get into. And who looks at it? Do you go, your 10-year-old on a YouTube, do you go every day and check what's on it? No. Does parental control stop them from? No, it may not, but it'll at least reduce the risk of what they can get into. So that's a basic level of understanding that every family should have. That access to unlimited information is good at times when you're doing a research or understanding, but it's not good for kids to have that open access. And you have to have some kind of a discipline or a boundary around it to help them. So screen time is great, but keep it in limit. American Academy of Pediatrics, AAP, they recommend certain hours. These are just guidelines. So if you're less than 2 years, it should be less than an hour per day. You can give them like 20 minutes as a fixed time. What I do with my kids, or what I did with my kids is, I said from 4 p.m. to 5 p.m., which is when they come back from school, even if you don't ask, I'm going to give you an iPad. There you go. I take it out from a shelf. This is your iPad. Sit there and enjoy. This is your entertainment time. And they play, they go on to different sites, they enjoy, and they come back and they hand over the iPad to me, and I keep it inside. The rest of the time, if it's work-related or school-related, text, typing, or yes, they go ahead and do it, or they go to their music classes, or they do a sports activity. I keep them engaged. And I also tell parents, there are many parents who come and tell me, look, he has a very fixed schedule. Every hour is counted. That's not good as well. And I tell them, if you don't have an hour for your child, and it's called an hour to do nothing, that means you're not doing justice to your child. Give an hour every day, which is not structured. Let them do whatever they want. Okay, that doesn't mean they hook onto screen for 1 hour. No, let them just run around, do anything. It should be an empty hour once every day for an hour. That they should remember. The positives of screens, we are seeing that. We're doing this podcast. Everybody has a mobile. We know how much it helps. But the amount of negative effect it has, even for us as an adults, I'm closing on 50 now, and my headaches, I suffer from migraine once in a while, my sleep, and my general psychological status, my balance, is being affected with excessive screen usage. But I know the negatives of it, so I'm trying to control it. But obviously, a child will not be able to do that.
It was said that because of excessive screen time, we have fragmented attention, or we change from one topic to another rapidly. They're saying that the screen time can cause that.
Yeah, I mean, see, if today you start learning Chinese or Mandarin, for example, if you want to learn, and I keep throwing videos at you, which are Mandarin, for 3 hours a day, every day, you would learn Mandarin in at least a year's time, because your brain absorbs what's thrown at it. Now, if you have a screen usage where you are seeing this continuous movements fleeting from one to another, one reel to another, on your, sitting on a toilet, looking at your mobile phone and scrolling through you expect that to happen in your life as well. And why will you have attention in one place for more than 20 minutes then? Because for you, life is less than 1 minute. That's what reel allows you, I think, yes. 1 or 90 seconds. You expect things to change. And if you don't, something happens to you. You are quite restless. I cannot focus on something more than 10 minutes simply because I know that life is 90 seconds. Things have to change in 90 seconds. And this is what kids do. And kids' brains are very malleable. They are very plastic, what we call as neuroplasticity. You can mold them. And over the last 10 years, screens have been molding kids' brains. We have to accept that. And I have this drive where I always tell schools, whenever I give a talk at schools or I interact with their special needs team or their educational team, I say, minimize the amount of screens you use to teach kids. I don't know how much of that they take on board, but still I see huge screens within schools being used for teaching. The blackboards are out now, yes. Obviously. There are whiteboards, and then from whiteboards you've had screens now. And this has to be some kind of a screen usage regulation within schools. I would urge KHD or anybody to think about this and kind of apply this within the school premise, where certain subjects should be screen-free. Hopefully one day it'll happen.
Hopefully. In your LinkedIn profile, it says associate professor. So can you tell me more about that?
Yes, Carlton. I love teaching, and I get very few opportunities to teach medical students, and this is one of them. So I've been an honorary associate professor at Mohammed bin Rashid University, which is in Healthcare City. And twice a month I go there and offer lectures for medical students in relation to pediatric neurology. And I've been doing this for the last 6-7 years now with Mohammed MPRU. And so that's one part of it. And the other part where, I obviously do seminars and conferences for doctors, probably done more than 300 lectures and seminars in the last 8 years I've been in Dubai. But I also provide some awareness talks to schools. And for the last 2 or 3 years, I have been harping about this concept where certain subjects and certain concepts that we teach at school have to be either altered or added to the curriculum. So I will ask you this, Carlton. When was the last time a child, or when did you learn about financial literacy or how to manage your money?
In my 30s, doctor. So yeah, not too long ago. Yes.
So generally people start learning about money when they start losing money. So even in the 20s, for example, if you have a job, you're earning a certain salary on a monthly basis. You would just earn, maybe spend a little bit more than what you earn or a little less, and somehow you'll manage with your credit card and all that. It's when the negative balance hits you, you start thinking, wow, what have I done? Let me start reading about how to manage money. So why don't we start teaching this to our kids from early on, say when they're 10 years of age? So financial literacy and relationship literacy, these are two things that we don't teach at school. If I knew how to manage relationships and how to manage money about 20 years back from what I know now, I would be in a different place maybe. And your subjects don't teach you this. They might teach you mathematics, they might teach you what currencies are, but not financial literacy. Simple thing by which, like for example, I know today that I cannot keep earning money. I cannot keep working for my money because there is a physical point where I cannot go beyond that. You retire at some point. So I cannot keep working for the money. I should start making the money work for me. And to do that, I need to know how to invest my money in the right place so that I can keep my same standard of living without affecting the way I live or my kids. And then money starts working for me and generating income for my daily expenses. And that itself is a subject in its own right. I'm sure you would have read of this book called Rich Dad, Poor Dad.
Yes.
And that's fascinating. And that's been, that released decades ago. But I get surprised when people say, oh, we've not read this. If you're listening out there, your parents, and if you want your teenage 15-year-old or an 18-year-old to know about financial literacy, let them read this book. I would recommend. But what I've started doing lately is my son is into editing. He does a lot of video editing and photo editing.
Your videos?
Yes, I'm coming to that. So he was doing this in his leisure time. And he was pretty good at his work. And he's 15 now and he goes to an IB school and he's pretty above average and brilliant in what he does. But this was his passion. So I said, why don't you make this a business? I said, why don't you send me an invoice telling me this is what I will offer you and I will give some of my projects to you. So I do videos, I do individual 20 minutes reels, 2 minutes reels and short videos. And I started giving videos to him. And his job was to edit it and give it back to me. And if I like it, I will pay him for it. And he will give me a receipt at the end of it. I'm going to bargain. I'm going to negotiate with him. I would ask him then, as a father, what you've done with that money, where you have invested it, how much you have saved, how much you have spent, and how you think it's going to grow over time. How are you going to grow your business? Instead of doing 10 reels a month, why don't you do 20? Why don't you reach out to this particular YouTuber and say, can I help you? Why can't you be on a Fiverr or there are many other platforms where you can show what you can do as an individual and put your skills out there. And we've started on this journey of financial literacy already with him, but he's 15. So this is just a message out there that teach your kids how to manage money. It's going to be very imagine algebra. You've read algebra when you were in your 10th and your 11th and your 12th, or trigonometry, for example.
Doctor, those two topics are very, don't bring out the best memories. So I think I've forgotten it.
You don't use it unless you're in that specific niche area. You don't use it in your life. You never ever think about a squared plus b squared is equals what ab squared or whatever it is. You don't do that anymore. But why a subject like money matters or money literacy, financial literacy is not taught to kids? Because your whole life you'll be managing what you earn and what you spend and getting the right balance right for yourself. So just a thought.
No, it is, because I agree with you completely, because we are taught to get a salary, work for someone, get a salary, and manage somebody else's money. So accounting is that, managing somebody else's money. But you ask a child who's graduating, how do you earn money? Or not by job, but how do you constantly earn money? How does money make money? Nobody tells you.
Knows that. Yeah. And see, when you're in your 40s and 50s, saving money is not a big deal because you don't have the energy to do things that you were doing in your 20s. Okay, the key is when you're in your 20s, if you have the financial literacy, to start saving and investing early on, because it's compounding, isn't it?
Yes.
When you start saving at 18, you can compound for nearly 40 years of your life. But now at 50, if I realize, oh, by the way, my future is at stake, I start compounding. I've got 10 years to compound. It makes a huge difference for your child's and his family's life or his or her family's life in the future. Start teaching them in their teenage years of how to invest, if not save, maybe at least invest appropriately at the right time, so that they reap the benefit of that investment when they are in their 30s, when they have a family to support. And they will then obviously think about you. Oh, my dad said this.
Tell us about your journey. Why did you get into this?
That's some time ago. So I became a doctor in 1997. And obviously when you become a doctor and come out, you're just happy that you're a doctor now and no more studies. But at least that I know that that's when everything starts. The uphill growth starts from there. Everybody who enters a medical school will become a doctor, or most of them. And that's the easy bit, I must tell you now. So when I came out from there, there were competitive exams. And as you know, in India, everybody pushes to achieve the highest position with regards to getting the best college, the best seat in a college. So we started looking for post-graduation opportunities. And eventually I did my pediatrics from India, post-graduation in pediatrics. And then I had two options, either to come to Dubai or explore UK or US as an addition to my educational background that I had. So I gave my preliminary exams. I entered UK. And the UK, the system was when you have trained in India, they would not acknowledge your certification from India, but they would acknowledge your experience from India. So I had this experience of working as a resident for 3 years in pediatrics. So I was kind of slightly ahead of the other doctors who've just moved from medical school and trying to do pediatrics. So I had that edge. So, but I decided, okay, let me do the whole pediatrics again. So I did about 8 years of pediatric training. And in the UK, when you train, you earn as well. So you can support your family. You have enough money to sustain yourself and your family. So did my medical school, my pediatric training there for about 8 years. Then nationally, you need to apply for subspecialty training. So you can become a pediatric gastroenterologist, pediatric neurologist, pediatric cardiologist, and so forth, based on a central exam. And why I became interested in neurology was because this was something I used to run away from. So when you work in emergencies in children unit, and if you have a child coming in with epilepsy or headache or head trauma, I used to be really afraid of that. I used to run away simply because examining a child neurologically is probably the most difficult thing to do. Your cardiac examination, your respiratory examinations are pretty straightforward, and we get trained on it very regularly. The moment it comes to neurological examination, it's very extended. It has many things that you need to remember. There are 12 cranial nerve examinations that we need to do. And I used to just run away from it. And while I kept doing that, I realized, God, I can't keep doing this all the time. So I started reading about it as a start. And I started reading about it. I couldn't stop. I just kept reading about it. And suddenly I realized, wow, this is fascinating. I know it's difficult, but it's fascinating. I said, why not? So I applied nationally for pediatric neurology training, and there were about 8 seats in the whole of UK, and I was selected for it. And I got a placement in a place called Nottingham, which is Nottingham and Leicester, which is the Robin Hood's county, as we say. And I started doing my training there. So 3.5 years I trained in pediatric neurology after that. So I remember being 36 years old and studying for one of my assessments or exams. And my son, who was next to me, he was 4, I think then. Yeah, 3 years old. And he was studying at the same time. So, and he used to ask me sometimes, Dad, you're so old, why are you still with books? I said, I think this is not going to stop. You will know that when you grow up, especially if you're into medical field. So I completed my training in pediatric neurology, became a consultant in the UK, worked there for 3 years. And I started doing, because my parents used to live here, I came down here and said, okay, let me start doing some practice here. So I affiliated with a very renowned hospital in Dubai, and they gave me the opportunity to do visiting clinics. Because at that point in Dubai, there were no pediatric neurologists except one doctor in the government sector. So I started coming for a week every 2 months to Dubai and doing pediatric neurology clinics for this particular organization every 2 months. And I realized that although people knew what epilepsy, autism and everything is, there were no holistic single centers. People used to go to a physiotherapist in one center, a psychologist in the other center. To see a neurologist, they used to travel to Abu Dhabi. So it was very fragmented. And I realized this is a big gap. we need to build something that can bring all the specialists within a single roof. So after about a year of doing this, visiting clinics with this organization, I decided, why not move here? I had a base already. So in 2015, I packed my bags. My family was still in Dubai, in UK. My wife is a obstetrician and IVF specialist.
Okay.
So she was working there. Then 2 kids were still with her. I moved here and I joined a center called American Center for Psychiatry and Neurology, and I was the head of children's services for 2 years. So I gained some not clinical, but administrative experience from there. And 2017, Neuropedia was created, and from there, everything, that's the history. So, and then we went from one organization to another organization and build up in a similar fashion. So when I was developing Neuropedia, one of my friends, Dr. Aman Sohal, who is also a pediatric neurologist trained from Birmingham, he decided to join with me. So, and it's been 7 years. He's my partner in with Neuropedia and supporting me to build that brand across the region. Yeah, so that's my story.
The podcast that you call in a lot of doctors to do, what made you start the podcast?
Good question, Colin. It's called Scrubs and Suits.
Yes.
So I developed that title simply because I wanted to make it self-explanatory. So we talk to professionals who wear scrubs, and we also talk to professionals who wear suits. So scrubs are your physicians and the medical professionals and the paramedical professionals. And suits are administrative professionals, people who run hospitals, people who run clinics, who do insurances, who do finances, who build healthcare policies for governments. These are the people wearing suits. So it was more of a kind of a depiction of what these two do. The reason for it was from the NHS, the National Health Service in the UK, our main pain point was the fact that clinicians don't speak to administrators, or the other way around. The administrators don't speak to clinicians, and there's a big kind of a gap or divide. So how healthcare is run in a region or a country or an organization, and who runs those facilities, there's a gap. So administrators used to make policies and would not involve stakeholders like physicians. Physicians used to do certain tasks within their clinical realm and not involve the administrators. And when they actually realized that's happening, they used to clash. And we always had this rifts between administrators and clinicians. Clinicians believe that the country is investing a lot of money into getting more and more managers and administrators. And managers used to believe that the clinicians don't give a damn about the finances of an organization, and they just keep spending money on their work, clinical work. So when I moved here, there's no National Health Service like in the UK, but it's obviously a private sector, a government sector and a private sector. So my experience with government sector in Dubai is not much, but I've worked for almost 9 hospitals in UAE for that matter. So I know how private organizations in healthcare work. And even there, I found a big divide. To an extent where I worked for a hospital for 2 years, I don't know who is sometimes I probably know the CEO of the hospital, but I would not know who is the CFO or who's the chief insurance officer, who's the chief IT officer or technology officer. I won't know that. So to bring that gap, so I want to know what they do. As a doctor, I want to know what a CTO does, what a insurance administrator does, what does a PRO in a hospital does. And that's why Scrubs and Suits was created. And the second motive behind creating that was there was no solid healthcare podcast in Dubai, which was run by healthcare professionals. And I decided, why not? Why? That's the best way to bring a very focused piece of information to the right audience who want to know about it. So, for example, autism. Now, when I got a developmental pediatrician to speak to me about developmental issues in children and autism, I informed all my families that I have with children with autism that this is being released. This is the link to that podcast. And the amount of positive vibes I got and thank you notes I got for that was just immense, because I was catering to their need where they wanted to speak to an expert, and not all had the means or the ability to go and see a developmental pediatrician. And though that free information that came out of it was bringing value to them. Similarly, I did a recent podcast with Dr. Tayara for pediatric dental care. And a simple understanding that you shouldn't go to a dentist when you have a problem. You should go to a dentist when you don't have a problem. And that message got passed. I asked a number of my own relatives who have kids, and I said, has your child been to a dentist? Oh, no, he's 6 years old, there's no issue. I said, what do you mean? No, there's no caries, he's not complaining of toothache, why should I take him to a dentist? That's the mentality we have. But as a rule, if your child is at least 18 months of age, you should go to a dentist or for an annual checkup for your kid. You should not wait for a caries or a cavity to happen or a teeth malfunction, issues to happen. Get it picked up earlier and prevent it, because preventative medicine is what's coming now. And that just opened my eyes. And that message was loud and clear for many. So making those small changes in parental behavior gives me a lot of satisfaction.
And even I get a lot of value from that. So good going. I really appreciate the content that you put out. And I'm sure everybody else does as well.
Thanks, Carlton.
Thank you so much for your time, Doctor. I really got a lot of information from you today. And is there any message that you want to send out to people out there for awareness and what or how can they behave or adjust or make things simpler for children who are neurodiverse?
Two pieces of message. Number one is, see, when you have a child who's 6 months of age, you probably won't know whether your child is going to be neurodiverse or he's going to be neurotypical. Okay, but it doesn't matter. The simple message is the moment you see or you have a hint that there might be something different about your child, or your child is not meeting the milestones, or your child's speech is delayed, go and see your trusted doctor. Don't delay that. Because whether it's a pediatrician or whether it's a developmental pediatrician, even your GP, go and see them. Raise your concern. What's the worst thing that can happen? They might say, look, there's nothing. They might say, okay, all is good, go back home. Or they might say, okay, why don't you go and see a neurologist or a psychiatrist? Do that. Because the reason I'm saying that is because, as I said, the first 2 to 3 years of a child's life is the best time you can change their wiring of their brain. If you've gone past that, no matter what interventions you put, the difference will not be much. So if a child has speech delay, it's likely that it's a familial speech delay and he will catch up. That's the most common scenario. But if it's not just familial speech delay and there is more to it than just speech delay, and if you don't pick it up, you will not be able to help your child later on in life. You have to pick it up early. So go and see professionals. The second piece of advice is more of advertising myself, which is I would recommend all your listeners to go on to Dr. Arif Khan. This is a YouTube, my handle, and there's a series of these podcasts you mentioned, Scrubs and Suits. And if they can subscribe to it, basically, and share that link to all your friends or relatives, I'm sure would benefit from listening to that. And there is no commercialization with this. I'm just doing it from my own pocket, basically. I have a team that works with me. I want for them to get most out of it. And if they're satisfied with what they're getting from it, and if they have picked up even a small message which has helped them, they can just send a comment saying thank you. And that would mean a lot for me. And pass it on to everybody else and ask them to subscribe to it and press the, I don't even know what to say, like button or notification button. And that will help me progress this further and make it more refined with time.
And I totally agree with you, Doctor. So everyone listening, the links will be in the description below. Click on it, subscribe, hit the notification, hit the bell icon and the like button. And that would encourage every content creator, especially Dr. Arif, who's doing a fantastic job with his team. Thank you so much for your time, Doctor. I really appreciate it.
Thank you so much, Carlton. And what you're doing is also fascinating because your approach is so wide. You just bring people in to talk about them. And for me, it's about healthcare. I'm very focused. But something like this, what you're doing is just amazing because you're reaching out to a wider population than what I'm doing. Thank you.